Welcome to a special series of This Week in Canton City Schools, where we will focus on the mental health and wellness of our kids and families. I'm Jacqueline Power, the broadcast media instructor here at the Timken Career Campus of McKinley High School, and your host today. The Canton City School District continues to partner with Child and Adolescent Behavioral Health Agency. This agency provides a myriad of resources to the Stark County community and, most importantly, to our students within our district. Each month, we will feature resources and strategies to help the mental well-being of our young people. On this episode, we are talking with Dr. Seandra Walker and Dr. Emma Farkas from the SIBR program of Child and Adolescent Behavioral Health. Sit tight, all of that starts right now. As we continue to look for ways to have a healthy, happy, balanced lifestyle, there is no greater need than to work with our mental health and wellness to meet the unique needs of our changing world around us. This series of shows with the Child and Adolescent Behavioral Health Agency will feature all kinds of different ways to address some of the common setbacks we face today. Today's content contains themes which may be unsuitable for our younger viewers. This content is a little more serious and a little more mature in nature, and as such, may be something you want to view with your child at your own discretion. Our continued partnership with CNA has enabled us to be able to bring you topics and content that span a wide spectrum of behavioral norms. So this particular topic is one that encompasses more mature terms and language. With that being said, the experts in this area are here today to help us navigate this heavy topic and help all families work with their children to create healthy, balanced young people ready for each step of mental and behavioral maturity as they grow into adulthood. So let's actually start today's segment with the introduction of some of the staff that will help us sift through our topics today. So we will start with you. So please just tell me a little bit about yourself, where you grew up, what college you attended, and we'll work backwards.
So my name is Seandra Walker. I am a clinical psychologist at Child and Adolescent Behavioral Health, and I grew up in Colorado, and I went to graduate school at the Louisiana State University.
Wow.
Yeah, all over the place.
All over. I love it. So tell me how you first became affiliated with CNA and what positions you've held so far in the agency.
Sure. Yeah, I started actually as a pre-doctoral intern. I got matched there through our internship program. And then after I graduated from LSU, I stayed on at CNA in their postdoctoral fellowship program. And then a year later, I became the SIBR program director.
So Emma, same thing. Tell us a little bit about you, kind of your background, where'd you go to school?
I am originally from Buffalo, New York. I did my undergrad in Pittsburgh and graduate program in Chicago, so also a little bit all over. I was
cold, windy, snowy locations.
Yes, it tends to be my trend. Well, I was looking for a postdoctoral position in which I could further train and work in the areas in which we're going to discuss today. And CNA thankfully had that position available, and thankfully I was accepted there and to further work and train under Dr. Walker. And so I continue to do that today.
So path led you to CNA. So is that so your postdoc, what was the very first thing you've worked? Is this the first thing I should say that you've worked with CNA?
Yes it is. Yeah,
okay.
My first role. Yeah.
All right. So as we kind of merge into the specific topic that we're here today for, as a program manager, will you share with us a brief overview of what the acronym SIBR means, and then a brief overview of the program, because we'll get into the details of everything in a few minutes.
Sure. So SIBR, SIBR, so that stands for Sexually Inappropriate Behavioral Remediation, and it's a specialized program at CNA that is for youth who are experiencing problematic sexual behavior or sexual offending behaviors.
Okay, so I guess, Emma, you get to kind of start things off. So talk about that sexually inappropriate behavior, and we're going to start with our younger kids.
Sure.
So what is considered typical and maybe what's considered inappropriate for kids as young as our 4 to 8 age group?
Sure. So typically we would always prefer kind of a cut and dry response to that question. Oftentimes we don't have that. So
Right.
Seandra and I utilize many frameworks when we're conceptualizing and working with various clients and their families. One is the traffic lights framework. So pretty straightforward, green, yellow, and red behaviors. Green behaviors would be typical, appropriate, safe behaviors. Yellow would be risky or concerning, either because of health, safety, or relationships. And then red would be unsafe, either harmful or abusive in nature. So for our younger kids, 4 to 8 years old, some examples of green behaviors would be just some body touching, masturbation, but with some awareness of that privacy and that need for privacy. Some other examples of green behaviors would be asking mom and dad some questions about sexual behavior. For example, how did my baby brother or sister end up in your belly, and things of that nature, right? So these would be green behaviors. Yellow, again, these are maybe concerning or risky behaviors. Some examples would be masturbation in a public setting, right? So without that awareness of privacy. Another example could be some inappropriate touching with a peer, possibly a same-aged peer. And then an example of a red behavior would be maybe some bullying with some sexual aggression involved, as well as maybe pulling up or pulling down the clothing of peers without their consent or without their approval. Again, this is obviously not an exhaustive list. We could probably spend all day talking about examples, but these are just some things to kind of think about and consider.
And kind of our markers.
Yes.
That
Yes.
like the traffic light. This
Yes.
is okay. This is we should be watching,
Yeah.
and this is definitely we need to reach out.
Exactly.
All right. So Seandra, then I guess advancing in age group, what's then appropriate for kind of our next age group, which is our 9 to 14-year-olds?
Okay, so these are like our middle school kids, right? So some appropriate or typical behaviors, sexual behaviors for this age group would include like masturbation, but in a private setting. Sexual conversations or crude humor with peers. We hear that in the schools, right? That's pretty typical. Trying to develop relationships or communicate with peers online. That's also very typical, especially with kids today. Some inappropriate or kind of like red light behaviors that we want to look out for middle school kids would be excessive or compulsive masturbation or them, touching themselves in a non-private setting. Forced or coerced sexual contact, so like Emma was saying, touching another child or a peer without their consent, or sending or publishing nude photos. That's also a very concerning behavior that we need to look out for.
So that kind of leads us into some of that explicit imagery piece. So the way people view explicit imagery has definitely changed over the past few decades.
Yeah, absolutely.
So how do you think the access to the internet and electronics kind of in our hands all the time has impacted our kids and teenagers and how they view that type of imagery?
Absolutely. So the access to internet today has undoubtedly contributed to children's access to explicit material or pornography. And this is especially true for kids who don't have monitored or supervised electronics by their parents. So they're walking around with a computer in their pocket and they have access to everything now. So that has absolutely contributed.
So kind of with that piece, the electronics piece, I know that both of my daughters who are 12 and 15, so they're right in that middle age group.
Sure.
They both have cell phones, they both have iPads, they have pretty much unlimited access to internet, like there's no caps on any of those things. So in recent years, sexting has been an issue to contend with for teenagers. Teenagers often think in the moment, hit send, don't think about the consequences of sending some type of risque picture of themselves. And from your professional experience, how does sexting affect kids and teenagers? Kind of the short term, and then we can talk about the long term effects.
Yeah, of course. So one of the really important topics that we get to talk about with kids and their families is that sexting is illegal in many states, including Ohio. One thing that's important to note is in Ohio, again, and with many states, it is a felony, even when it's involving minors. So minor to minor sending or receiving. So that is something that's incredibly important to note with families and just kind of keep in mind. So with that said, many legal consequences can take place and kind of go from there. Some other consequences, again, not an exhaustive list, some depression, anxiety, low self-esteem, bullying, harassment from other peers if videos or pictures are being sent out to others or shown to others, sextortion, which Dr. Walker is going to talk about more in a little bit, trafficking. I mean, the list kind of goes on and on. Sexting can be extremely damaging to a lot of peers, or excuse me, a lot of youth, and this is something that a lot of families kind of need to be aware of.
So I'm a mom, like I said, of a preteen and a teen, and I also have a teenage stepson at home that's finishing up high school.
Sure.
And they have instant access to their friends in the outside world nearly 24/7 through their phones and other devices. Sure. What kinds of conversations as a parent should I be having with my preteen maybe versus my teenagers? Because I realize like my preteen is in one category, but with my teenager kind of sort of because she just kind of fell off. So do those conversations look different? Are there some similar things I should be talking to my middle schooler versus my early high school and late high school? How do I even start those conversations?
Sure, yeah. So those conversations should actually be started at a very early age, even before those electronics are given to our youth. Those conversations should be open, should be honest, developmentally appropriate though, right? So if we have a child who maybe has a different level of understanding compared to an older or a younger child, we want to make sure that that information is appropriate for that youth to understand. But we want to be honest with our kiddos, and we want to make sure that they're aware that even though, hey, we're handing them this device, that does not mean that they have 100% privacy with that device, right? You're still mom, you still love and want to keep them safe, and so you're going to be able to have access to their device, not because you don't trust them, right, but because you want to ensure their safety. That's your job, that's mom, right? And so for any parents and caregivers, that's our role. And again, just reassuring your child, you know, it's not because I don't trust you, but it's because it's my job to keep you safe and within the world around you. Again, just keeping those conversations open and honest, and reassuring and reiterating to your child kind of throughout the years, come to me with questions, come to me with concerns. If you're hearing things from other kids at school, peers, social media, things of that nature, let's talk about it. Let's see what's going on. Fill me in, and just really keeping things open. Yeah.
Which I think is great advice. I know, my daughters, it's one of those things that I say that exact same thing, like I'm not invading your privacy, like I want you to have that, but I don't know what other people around you are saying and doing, and you may never have navigated that kind of situation before. So when visiting the website, Seandra, this ties into kind of that previous question. I noticed a blog post on sextortion. Some of our viewers may have first heard about the sextortion from a recent tragedy involving a male student in Aurora. So explain what that is, and then what should parents be looking for, and how is this really affecting our kids today, our teenagers falling victim to what seems to be a growing trend, unfortunately.
So sextortion is a new term, but not necessarily a new concept, right? So sextortion is a type of exploitation that's happening where an adult or teen perpetrator will act as if they are a younger child or a similar age peer to a victim, and coerce them into sending a sexually explicit photo or video. Once they receive that photo or video, then they start making threats that they are going to distribute that photo or video to the child's friends, family, to the school, post it online, unless they comply with their demands. So some demands, common demands that a perpetrator will say, you know, send me more videos or send me more photos or send me a large amount of money. We've heard that from some of our youth as well. And then immediate effects from that, right, are just shame and embarrassment and anxiety and fear, depression. We see a lot of the fear of the legal and social consequences too, of like, what if they're right? What if they send these photos and videos out? What am I going to do? And unfortunately, we see that contributing to the delay of disclosure. So kids will keep this inside and not tell mom and dad because they don't want to get in trouble for initially sending that first photo or video. So parents should look out for some of those mental health concerns, like immediate social withdrawal, more like heightened privacy, not wanting their parents to be involved in anything online with them. And like Emma was saying, as parents, start having these conversations with your kids. Ask them, hey, I've noticed your behavior has changed a little bit. What's going on? And open that door so that your child can disclose and let you know if something's going on.
I mean, we do hear about the cases in the news, and like I said, as a mom of 2 young girls in my household, I feel like, oh my gosh, that stranger danger concept has kind of shifted its focus. So what types of specific things should I be including in those kinds of stranger danger conversations that look really different right now?
Right.
And what should I really be talking with my kids as it relates to the online activity of this nature? So we've kind of shifted focus from okay, they've got puppies or candy, or they're offering you something and walk, like that physical in that environment. You work with your kids, but this is in cyberspace.
Right.
So what do those conversations look like just a little bit differently than kind of when I was growing up and stranger danger looked a lot different? Yeah.
Exactly. So decades ago, stranger danger was in essence a simple concept, right? It was, if you don't know this person, don't talk to them. If somebody comes up to you and they're in a white van and offering you candy, don't go with them. Like it's funny thinking back to it, but now today stranger danger looks so different, right? Everybody online is a stranger. Kids truly believe when they're playing online games or talking on social media that they know the other person on the other side of the screen. They believe it's a same age peer who has similar interests, who gets them, who's their friend, and they don't know that person. And so online predators are particularly good at manipulation and grooming. They know how to act like a similar age peer who's just wants to be there for them or understands them when nobody else gets them. And so they feel the child feels a connection to them, but they're a stranger. They don't know who they're really talking to. So like Emma said, having these conversations as early as possible, as soon as a child is online or is playing online video games, having this conversation of you think you know who you're talking to, but you don't. So here's the information that you should not be disclosing. Here's the information you are allowed to disclose, which that list is a lot shorter. And just having kids learn at a very young age that if you don't know the other person on the other side of the screen, if you've never met them in real life, if you don't know it's Tommy from class, it's a stranger.
So just treat them all the same unless you physically know who they are, have met them in person, which was kind of my Snapchat rule for a while with my children, but that has since, because that's the same thing, like those social media platforms, whether it's a gaming platform or it's a social media app, that you can be anything you want to be online.
Exactly.
And none of that can be true.
Exactly. And we can't prevent children from talking to others online. It's going to happen, right? Like, let's be realistic.
Right.
Online gaming, they're going to play with other people across the world, which is pretty cool. I mean, it's a neat concept, but they also need to know in the back of their minds they don't know that other person, so I'm not going to tell them where I live. I'm not going to tell them my full name or send pictures of myself because I don't truly know who they are.
Smart advice. So we're going to switch gears a little bit. Emma, it's my understanding many of your clients are court appointed to receive CNA services. What programs, treatments do you guys offer adolescents so that they are better able to understand the effects of their behavior?
Sure. So our SIBR program has 3 tracks, if you will. The first being our Healthy Sexuality program. This is an 8-week group-based curriculum, usually roughly ages 12 to 18. We have boys groups and girls groups. And this is mostly psychoeducational in nature, covering kind of the basics, right? Consent, healthy relationships, sexual education, things of that nature. And then we have what we call just kind of cyber, plain cyber. And this is for youth who are, again, not adjudicated, not court involved, but for some reason either aren't appropriate for the group format or group setting, or maybe even just too young for the group format. And this is individual therapy. And then kind of the third track or third tier would be full treatment cyber. And this is for youth who are adjudicated, they are court ordered or court involved. They have a charge are legally involved. And so these individuals do receive individual therapy, group therapy, sometimes family therapy as well, case management, kind of the list goes on depending on their needs. And for all of these programs, we do use evidence-based models for juveniles or for youth who have either inappropriate sexual behaviors or sexual offending behaviors.
So you kind of mentioned how long the program goes for. Does that change based on the track? Okay,
Yes.
so let's talk about that, and then we'll kind of go into when they're ready to kind of like exit the program and then what happens. So.
Yeah. So healthy sexuality is 8 weeks or based on 8 courses or 8 classes. SIBR, kind of plain SIBR, can kind of vary, just again depending on needs. And then full treatment SIBR for youth that are court ordered or court involved ranges from about 9 to 12 months.
And so once they finished up each one of those, how do you know they're ready to kind of head out on their own, and then what kind of follow-up takes place?
Sure, yeah. So for those clients, we definitely want to see a pattern of safe behaviors, both sexual and non-sexual, kind of throughout their journey, right? We want to make sure that, again, throughout treatment, they're honest throughout. Mistakes are going to happen, goofs are going to happen, but it's all about honesty and about acknowledgement. Hey, I messed up. This is what happened. What can I do to work on that, right? And again, just responsibility throughout, safety, as I mentioned. And again, just taking the program seriously. If they're on probation, again, taking probation and probation rules seriously. Again, working with the family. If the family is following safety planning and rules throughout, we want to make sure that that's just a big component. It's crucial. And then towards the end, we work on, again, safety planning for when they're out of treatment. If there's reunification steps that are involved, we want to follow through with that. And then if general therapy is needed for maybe anxiety, depression, trauma, we see a lot of trauma with our clients. We make those recommendations as applicable.
So, Seandra, in wrapping up this interview, what amount of clients struggle with that sexually inappropriate behavior are kids who have been abused or witnessed abuse prior to that? And then kind of what is that correlation between those acts?
So that's a good question. There's this misconception that all youth who have problematic sexual behavior or offending behaviors have been sexually abused themselves. And of course, we have clients who have been sexually abused or have a traumatic background, but that's not all of our youth. There's definitely some other contributing factors, such as, and you touched on it, like exposure to violence, like domestic violence, experiencing physical abuse at home, exposure to pornography or adult sexual behavior at a really early age, which we're seeing because kids have access to the internet at a very early age. Lack of parent supervision or monitoring of devices, which kind of goes into that early access of sexually explicit material. And then substance use, chronic trauma, those are all contributing factors that we've seen more as a correlation, in addition to their own sexual abuse history.
Okay, so Emma, what advice can you provide for parents, legal guardians to ensure that their children are being safe and engaging in that typical healthy behavior?
Sure. So kind of like I mentioned earlier, starting conversations early, right? So even from, young toddler age, we're using correct terminology. We're not sugarcoating words. We're using correct bodily, anatomy terms. We're educating our kids on, as Seandra touched on, stranger danger, but more applicable to today's day and age. When we hand over the electronic devices at those early ages, we're educating right away. We're keeping those conversations open. We're keeping those relationships open. We want to make sure our kids know they can come to us with those questions and concerns. And as Seandra mentioned, if we notice any changes in our youth, whether it's, they're isolating themselves more often, they're becoming more private with those electronics, or even just with who they're hanging out with or talking to, call them out, talk to your kids, see what's going on. Your kids know you love them, and you want to make sure that they're safe, and this is how to do it.
All right, so Seandra, finally, if a parent feels their teenager is struggling with inappropriate sexual behavior, what number can they reach out to you both to kind of help get the help that they're going to need? Sure,
yeah. So online at childandadolescent.org, we have information about the SIBR program and additional resources for parents if needed. If they would like our services, they can call us at the Belden office at 433-6075.
All right, so thank you both so much for all that information, all those resources. Thank you for being here and being so candid with such a weighty topic like this one that we were able to cover today. So thanks for being here. For more information on this topic and so much more, you can visit the CNA website at www.childandadolescent.org or call the CNA office at 330-433-6075. Thanks as always to Dan Mucci, Marketing and Development Coordinator, Office of Mission Advancement of Child and Adolescent Behavioral Health, for helping to coordinate this episode, past episodes, and all the episodes in the future during this partnership. As for TV11 staff, we'll continue to bring you an inside look at the district each week during the regular school year, in addition to this series of shows on mental health and wellness. So if you're a staff member and would like to have a feature story on our program, please email me at power_j@ccsdistrict.org and our station administrator, Bill Widener, at widener_b@ccsdistrict.org. We'd love to have you in the studio to showcase the valuable experiences our kids have here at the Canton City School District and the supports we have in place to educate the whole child. Please visit our website at ccstv11.com, where you can get information on all of our shows and watch us on your favorite device. We will see you next time.